The lungs are pyramid-shaped, spongy, air-filled paired organs within the thoracic cavity. These vital organs are protected by the rib cage. A pair of 12 ribs are present on each side, which supports the posterior, lateral, and anterior surfaces of the lungs. The lungs are the major organs of the respiratory system and are considered part of the lower respiratory tract. The lower respiratory tract consists of the lungs, trachea, primary, secondary, and tertiary bronchi, bronchioles, and alveoli. The larynx is also considered part of the lower respiratory tract. Functionally, the respiratory system is separated into a conducting zone and a respiratory zone. Conducting zone consists of the nose, pharynx, larynx, trachea, bronchi, and bronchioles. These structures form a continuous passage for air to move in and out of the lung. The nose and the pharynx are considered as part of the upper respiratory tract and will not be discussed here. In contrast to the conducting zone, the respiratory zone consists of the structures that are directly involved in gas exchange. The respiratory zone is made up of the respiratory bronchioles, alveolar ducts, alveolar sacs, and alveoli. Respiratory zone allows inhaled oxygen to diffuse into the blood within the lung capillaries in exchange for carbon dioxide, which is released into the atmosphere via conducting zone. Although the main function of the respiratory system is to provide oxygen to the blood and to remove carbon dioxide from the blood, it also plays an important role in maintaining the acid-base balance. The angiotensin-converting enzyme, located mainly in the capillaries of the lungs, also plays an important role in the regulation of the blood pressure. The upper part of each lung is known as the apex. There's a dome-shaped muscle just below the inferior surface of the lungs, called the diaphragm. The diaphragm, together with intercostal muscles, plays an important role during respiration. The space between the two lungs medially is known as the mediastinum. The heart, some of the major blood vessels, trachea, esophagus, and the phrenic and the cardiac nerves, thoracic duct, thymus, and a number of lymph nodes are located within the mediastinum. The lungs are enclosed by a double-layered membrane called pleura, which is attached to the mediastinum. The right lung is shorter and wider than the left lung, and the left lung occupies a smaller volume than the right lung. The surface of the lungs which borders the ribs is known as the costal surface. The right lung has 3 lobes, and the left lung has 2 lobes. Fissures separate these lobes from each other. The lobes on the right are called upper, middle, and lower lobes. Sometimes these are called superior, middle, and inferior lobes. The left lung consists of upper and lower lobes, which are also called the superior and inferior lobes. Each lobe consists of smaller anatomical structures known as bronchopulmonary segments. The trachea, pleura, bronchopulmonary segments, and the mediastinum are described in details in other videos. The surface area of the respiratory zone of the lungs is roughly 70 square meters, which is brilliantly compacted into a comparatively smaller thoracic cavity and is highly permeable to many gases. Interstitium of the lung. The pulmonary interstitium is a collection of supporting connective tissue within the lung that includes the alveolar epithelium, pulmonary capillary endothelium, basement membranes, perivascular and perilymphatic tissues. It also has elastic and collagen fibers, which play an important role in lung compliance. The elastic properties of the lungs come from the elastic fibers. Damage to these fibers, for example due to smoking, results in conditions like COPD and emphysema. The alveolar region, which is sometimes referred to as parenchyma of the lung, comprises about 90% of its total volume. Thanks for watching. See you in the next lesson.